Hi, my name is Kellie Conley, and I'm going to be doing my Integrative Review Presentation for NSC 890 to follow along with the PowerPoints that I created. The healthcare problem that I'm going to be focusing on today is childhood obesity, with a focus on sedentary lifestyle factors and screen time viewing related to childhood obesity. In literature, we find some major contributing factors to childhood obesity, those being genetic factors, low levels of physical activity, poor diet, and then a sedentary lifestyle, which is where I'm going to focus. Childhood obesity has really become an epidemic, not only in the United States, but worldwide as well. Research has shown us that screen time viewing is really linked to childhood obesity. We used to think of as screen time viewing as just being television, but not anymore. We think of it now as being cell phones, video games, handheld devices, tablets, computers. Pretty much everything we do in our day-to-day life is linked to a screen, and screen time viewing has really been linked to childhood obesity and higher levels of BMI. The American Academy of Pediatrics recommends that for kids older than 2, they should limit their screen time viewing to less than 2 hours a day. And if they're less than 2 years old, screen time viewing should be avoided altogether. However, studies in the United States show us that school-age children watch television for an average of 3 to 4 hours per day. And when other screen time media is factored in, those numbers jump to 5 to 7 hours per day. So clearly the AAP recommendations are not being followed. This is what research tells us. When thinking about this, the question could be raised, can a reduction in screen time viewing lead to lowering BMI in school-age children? After I posed this question, I started a research review of the literature to see what I could find. And what I found were vast amounts of literature on childhood obesity and the contributing factors. But I was really looking at research studies. I found lots of different research studies, and I ended up with 3 randomized controlled trials to analyze to help me answer my clinical question. The 3 RCTs that I found were very similar. Since they were RCTs, they had an intervention and a control group. They were all intervention-based. The interventions were for the children who were school age 6 to 12 years old, and their parents or their primary caregiver. And the goal of the interventions were to lower BMI or improve the BMI, reduce screen time, and increase the physical activity levels of these kids. Different variables that were measured and assessed included BMI, body mass index, levels of physical activity, sedentary time, including screen time viewing, and dietary consumption. The RCTs basically found that the interventions did not really improve upon the outcomes. However, they identified that there was a clear problem and correlation found between these contributing factors in childhood obesity, especially the screen time viewing. And a conclusion was made that there is a strong need for increased education and teaching to the pediatric patients as well as their parents about these contributing factors. So as advanced practice nurses, what can we do? I feel that through literature review, the advanced practice nurse should really be aware of these contributing factors and all the statistics out there that point to an increase in screen time viewing really being linked to childhood obesity. We need to provide a major focus in education and teaching to the pediatric patients as well as their parents or their primary caregiver on the amount of screen time that these kids are that are occurring with these children. This must be done in conjunction with an assessment of the other key identifying factors that lead to childhood obesity, such as diet, physical activity, genetic components, because those all go hand in hand with the sedentary lifestyle and the screen time viewing. So a change in practice would just be an increase in education, and where I feel this needs to take place is in the primary care setting. This will be the optimal health environment for that. I feel that each time a child comes in to receive primary care, their height and weight must be assessed and their BMI should be calculated. I think as advanced practice nurses, we could provide questionnaires to the children and their parents, asking questions about their sedentary behaviors, including the amount of screen time that they are getting every day. I think this will really help to initiate a conversation with the child and the adult about these sedentary lifestyle factors. Through education, we just really empower the pediatric patient and their caregiver to want to combat these factors that are really affecting childhood obesity. I want to finish my presentation. My final slide is just actually a picture of my two daughters. I have two little girls, ages 7 and 3, and I look at them and I realize how important the battle against childhood obesity is. I've worked in the schools before as a school nurse, and I see how detrimental childhood obesity can be. So for us as future nurse practitioners, I hope we just look at our own kids and realize that the increase in education and the work that it's going to take to combat childhood obesity really should be worth it. Thank you guys for listening to my presentation.